there is very much a need for rural research, and my research topic is going to be on rural nurses specifically. When you've seen one rural community, you've seen one rural community. Each community, and that's so true even in North Dakota, you have a very similar ethnic background across the state. But each community, it develops on its own outside of, external pressures, and each is so unique, and the problems and concerns for that community are unique. So trying to make a blanket intervention or fix a problem with a blanket solution isn't going to work, because you have very unique, strong, resilient individuals that are living in these communities, and you need to meet them where they are and work with them where they are. There's not a lot of research on those that are caring for everyone in a rural community. And so I'm going to be looking at the levels of moral distress and the experience of moral distress of rural nurses. Most of the research that's available on moral distress were done in urban centers, large healthcare systems, large hospitals. And those experiences are unique to those areas. But we don't understand what the rural experience is for nurses, what causes moral distress specifically for them. There's very likely going to be some overlap, but there's also very likely going to be things that are very specific, very niche for a rural nurse. So I want to find out what that is. And by finding out what that is, then you can work to develop interventions that are specific to that group. And you're not going to be able to generalize it to every single rural community, but for the group that you studied, you're going to be able to have a starting point, a springboard, if you will. I have the privilege of working with a large Midwestern healthcare system, and I'll be able to dive into the rural experience in nurses across 4 states. And I'm going to be looking at the most rural communities.